everyone. Coming at you today with some FAQ on the COVID-19 mRNA vaccines to help you address vaccine hesitancy, which, as we all know, is a really big issue. And you are fielding questions from patients, family, colleagues, co-workers, and wanted to present to you some commonly asked questions that Len and I have been receiving and address concerns surrounding the vaccines, including the speed at which they were rolled out, safety and AEs, and some other commonly asked questions. We think it's really important to help address and improve vaccine hesitancy, to take a moment and pause and understand why people are hesitant so that you can discuss and educate. So the first question is, how is the vaccine created and made available so quickly? A lot of people are disturbed by this, and I like to remind them that it mainly was because of resources. There were no shortcuts made in terms of safety. It certainly went very quickly, and we look at that as a miracle of science, but it's not because of safety shortcuts. And I like to reassure people that the vaccines went through all the appropriate steps that would be taken for any vaccine development program, from animal studies to huge phase 3 clinical trials, and more quickly because it's a pandemic and there was need for speed. So we look at it as a good thing and not a scary thing, and not shortcuts taken in terms of safety. What about, is the vaccine safe in general? In particular, talking about the mRNA vaccine products, is not a live virus. It does not cause disease. The genetic material cannot integrate into our genome. There's no viral shedding. And the mRNA technology generates a strong humoral and cellular immunity. And the long-term safety and durability, we don't know yet, but so far there's excellent safety records. And to put it in perspective, I like to think of it this way: almost 30 million Americans are known to have COVID, probably honestly a lot more, and almost 500,000 of them have died so far. And about that same number, almost 30 million, have now been vaccinated with these mRNA vaccines in the United States, and no one has died. So to choose the path to immunity, the safer choice is the vaccine and not COVID-19 infection. Just to present some 30,000 foot view of both of the mRNA platform products, Pfizer and Moderna. They both are 2 doses. Pfizer's given 21 days apart, Moderna's given 28 days apart. No major serious safety concerns. Large scale clinical trials, almost 30,000 patients for each vaccine were done. We previously presented information on the anaphylaxis reported with both vaccines, and it is quite rare, as you can see here. And of course, these clinical trials didn't include special populations, children, pregnant, and lactating women, which is the same for any initial clinical trial of a vaccine. So this is a common question that I get asked from colleagues, friends, and patients: is this safe to get if you're pregnant or breastfeeding? And while, as I said, they weren't included in the clinical trials, COVID vaccine is recommended to be given to pregnant and lactating women. And we actually know that pregnant women who are infected with COVID-19 are at higher risk of severe disease, hospitalization, intubation, and death. And this recommendation is now supported by CDC, Society for Maternal Fetal Medicine, and American College of OB/GYN. And there are links here to those documents, supportive documents that we've shared with you in the past. And I have gotten a good amount of questions on, is a vaccine going to impact male and female fertility for those trying to conceive? And there are no data to support this. This is not a concern at present. Why are there 2 doses? People are, for whatever reason, tripped up by the 2 doses. And this is not novel to COVID-19 vaccine. The first dose primes the pump, if you will, and the second dose boosts the efficacy and makes it more durable. And there are many vaccines that we've all received that come in multi-dose sequences, 2, 3, and 4 doses, including these that you all are familiar with. What about the side effects? I think it helps to set expectations that there likely will be side effects, both local and systemic reactogenicity, and to prepare to not feel great for a day, and probably just a day, in mild or moderate form, whether it be pain, Fevers, chills, aches. This is your immune system working. This is not something abnormal or something that shouldn't be happening. This is the vaccine doing its thing. And here's just a snapshot from the Pfizer clinical trial. Local reactions were common, as they are for most vaccines. Systemic reactions were also, common. Fevers, headaches, myalgias, mostly mild to moderate and resolving within 1 to 3 days. Interestingly, adults 55 and older had a lower incidence of these reactions. And I think important to highlight is that the safety profile was similar across groups, including gender, ethnic, racial groups, and different comorbidities. This is a really nice resource for you, for your staff, for your friends and family to read, updated very frequently on the CDC website, and goes over a lot of these FAQ that we're talking about right now, including what if I've already had COVID? Do I need the vaccine? You should still get vaccinated. It's okay to wait up to 90 days. This is CDC recommendations, and we're learning more about duration of immunity from natural infection, but we don't know how long. We don't know if everyone has durable immunity. Patients with milder infections might not last that long. So it's okay to wait up to 90 days, but you don't have to. And it's safer to get vaccinated prior to that 90 days. What if you've had COVID or COVID exposure in between the doses of your vaccine? Also okay to get your second dose as long as you've recovered from the acute phase and are outside of your quarantine period. So in short, you can get vaccinated even if you had COVID as long as you've recovered within 14 days of getting another vaccine, before or after. If you're immunosuppressed, which we've talked about before, pregnant or breastfeeding, and if you've had a history of allergies. Hopefully you found this helpful. And as always, reach out to Len or I with any COVID-related questions or to New York State Rheumatology Society.